President Goodluck Jonathan has commended the Lift Above Poverty organization LAPO for spearheading and promoting a bottom-up advocacy for cancer prevention, detection and management through its LAPO C4 initiative. The former president, who was the chairman of the 28th Annual Development on Promoting Cancer Control Program in Nigeria, the LAPO C4 initiative, held at Yaradua International Conference Center, Abuja, said he was pleased that the founders of the pro-poor organizations have for years provided a veritable platform for the downtrodden, especially in rural communities.
Appreciating the work of this husband and wife, that from microfinance, creating wealth, they realize that you cannot create wealth in a sick society. If people are sick, they cannot create wealth. First, people must be healthy. Even to go to the farm, you must be healthy. So they did not limit themselves to the wealth creation through the microfinance projects that they read out to us alone, but now ventured into public health issues. And I have to commend him. I have to join also the moderator, who has emphasized over and over that instead of using the money to buy jets and fly around or buy expensive cars or live in prisons we call mansions, they are now using that to impact society positively. We thank you. And just like the special guest of honor said, we join all other Nigerians to pray for you and wish you more success.
In his address, the former Deputy Governor of Edo State and ex-Chief of Staff to the former President, Chief Mike Oghiadomhe, who was the special guest of honor at the occasion, said,
I believe that non-governmental organizations and foundations like LAPO, which is trusted by the people, which I see as a change agent, because the people believe in you and you have earned their confidence. Such agencies should be encouraged to drive this all-important national program. My belief is that agencies that are trusted, that do things that the people see benefit, should drive a process of rearmament as one of their sidelines in helping to rediscover Nigeria and our people. On cancer per se, early detection gives opportunity for effective treatment and full recovery. Personally, I'm a cancer survivor, so I can attest to the efficacy of early detection. In 2014, due to regular medical checks, I was diagnosed with an aggressive malignant growth. The growth was just at that time a quarter of a centimeter, as small as that. But it had the capacity to overwhelm my entire system within 4 months because of the rate of growth. Because it was developed, it was discovered that early, it was neatly removed. And here I am today. I didn't have to take Panadol after that.
The representative of the co-host and Honorable Minister of Health, Dr. Ehanire, said,
These three health systems, orthodox, traditional, complementary, are recognized by WHO. When I say traditional, complementary, alternative, we need to understand what we mean. Nigeria must begin to look into its own indigenous flora and fauna. And that is what we are doing. I am happy that this is a community-focused organization. In the community are God's-given agents in terms of medicinal plants for the treatment of human beings in terms of ailments. We are trying to research with institutes like NIPRIT, the National Pharmaceutical Institute, to be able to discover and have medicines for the benefit of our people. We cannot continue to rely on importing everything. If we continue to do that, we have nothing to say. COVID-19 is an example. we must begin to look inwards so that God will be happy with us. He has blessed us with these plans. What we need to do as scientists is to take them further. And you have agreed with me that cancer treatment is holistic. Curative is not alone, preventive, and the use of supportive therapies. Supportive therapies in terms of improving healthy lifestyles, good nutrition, and organic foods that are there in the community. I would want LAPO to be able to use this opportunity at community level to grow organic foods for the benefit of patients, even at that community level. Creating job and creating awareness is to identify some of these useful plants that are medicinal, that are antioxidants, that support the immune system for the benefit of our people and the cancer patients. If we do that, we will definitely be able to ensure that we achieve the universal health coverage. Curative is not the only way to go. God has blessed us. Let us use that.
Others who spoke to Bloomshire include Professor Omoka Adeleye, who was a guest speaker, Dr. Osare Emokbai, who was the Chairman Board of Directors of LAPO, and the founders and CEO of LAPO, Dr. Godwin Oghiadomhe.
What is LAPO C4? How our knowledge of cancers informed LAPO C4, and what is the story of LAPO C4? What lessons can we learn from LAPO C4, and how do we look ahead about LAPO C4? We also want to advocate to all governments at all levels in their agencies, non-governmental organizations, communities, the international community, and individuals to extend, support, and replicate LAPO C4. Lift Above Poverty Organization is an NGO. It's not for profit. Founded, as we have already been told, it is committed to poverty alleviation through sustainable and responsive social and economic empowerment of vulnerable and disadvantaged groups in Nigeria. Now, you might wonder, why did I say who is LAPO rather than what's LAPO? The reason is simple. LAPO is a living thing. LAPO is alive, undoing poverty from lives.
Well, we are here for the 8th edition of the annual LAPO Development Forum. The forum was initiated in 1994, mainly to bring people together from various disciplines and with various experience and expertise to come together and address specific issues. Today we are addressing the challenge of cancer and presenting what we have been doing for the past 5 years on the community-based campaign on cancer control. The beauty of it is that it has been acknowledged nationally, and of course it is also taken as the first community-based approach to addressing the challenge of cancer. We've done that, and today we have the presentation and discussion. Well, my inspiration for this specific project arose from the fact that we ordinarily, as an organization, LAPO, both as a microfinance institution and health institution, we're coming across a large number of our women who were actually victims of cancer. But because ordinarily I have a very strong emotional attachment with all the clients of LAPO, and I was mostly in agony when I would come across a woman, down with advanced case of cancer. And I strongly felt that we need to address it from the root. That is ensuring early detection. And so the best way was for us to go and apply a community-based approach in terms of control, a set of campaign for awareness creation. And Lift Above Poverty Organization, LAPO, was set up in the late 1980s. That was informed by the rise in the level of poverty after the implementation of the structural adjustment program. It was basically to address 3 dimensions of poverty. The first is material deprivation, or not also having access to finance or lack of credit, which we addressed with microcredit that eventually became the LAPO microfinance bank that has programs across Nigeria and also in Sierra Leone. The second dimension was health. We strongly believe that poor health is a dimension of poverty. We decided to address that. For over 20 years, we were addressing it with awareness creation. During the HIV pandemic, LAPO was at the forefront of creating awareness, especially in rural communities. And that eventually has ended with the establishment of the Benin Medical Care in Benin City, which is a premium hospital and a diagnosis center. The third dimension of poverty for us was social exclusion. And so we've also been doing that, by implementing what we call social empowerment activities. So it has grown up to become a sort of a collection of other institutions providing microinsurance, micro-leasing services, of course, the microcredit program. Collectively today we have about 10,270 full-time staff within the system, and we hope that we could do more. But we are prioritizing the cancer scourge and how to address it.
Another thing I think I'm walking away here with is based on the extensive work that has been done for C4, my practice as a pharmacist, I could also help spread the news about awareness, lifestyle changes, and how people could do early screening and detection to prevent the incidence of death with cancers. Get aware as much as possible, learn more about the cancers that are prevalent in our society, talk about lifestyle changes, reduce alcohol intake, stop tobacco, and lifestyle changes that when adhered, the incidence of cancer will not be as prevalent as it is, as what we are seeing, especially in Nigeria and in Africa generally. LAPO is doing well. This is the second time I am attending their scientific presentation like this, and it's really interesting. It's enlightening us, and I want to say they should keep up their good work.